Hey guys, it's been a long day today, and after a whole day of procedures, what better way to decompress than to watch a stressful medical drama like House M.D. In any case, I'm going to be reacting to Season 2, Episode 8, so this goes way back. I'm pretty excited because I was told that there are some GI conditions involved in this episode. I watched a couple episodes back in college, but I really don't know anything else about the show. And back in college, I definitely didn't know what was realistic, what was accurate. In any case, let's just jump right in. And before we get started, please don't forget to give this video a thumbs up and subscribe if you want to see more videos from me, and turn that notifications bell on to be notified every time I post a new video. Alright, enough said, let's get started. Okay. She's opening up a pill bottle and popping pills in the middle of this recital. Uh-oh. Uh-oh. Oh my god, did you see her face? So apparently Dr. Chase is facing some sort of malpractice lawsuit, I'm assuming related to that lady that we just saw. So let's just see what's going on here.
Taylor presented to the clinic with multiple joint and stomach pain. Dr. Foreman was called in for a neurological consult.
What's the point of this, man?
Checking your sister's cerebral coordination.
The thing is in her leg and her stomach. Wait in the clinic for 6 hours so she can play patty cake.
Could go out to the ER.
That's a long time to wait in clinic. 6 hours?
Okay, patient comes from a family of jerks, I get it. Can you stick to the medicine?
Something wrong?
There was some uveitis.
Meaning?
Her iris, the color part of her eye, was inflamed.
Meaning?
Worst case, blindness. But there was an upside. It was weird enough to get House interested.
Young woman, joint pain, gonorrhea is a possibility.
It's polyarticular. Maybe rheumatoid.
That's typically small joints. This hit her knee.
Since the whiteboard says multiple arthritis, stomach pain, and uveitis, and the fact that she mentioned gonorrhea, this reminds me of that medical mnemonic that we learned in medical school: can't see, can't pee, can't climb a tree. And this refers to you can't see because you got inflammation of your eye, uveitis. You can't pee because you got inflammation of your urethra in men, or your cervix in women, and can't climb a tree because of arthritis. And these three things seem to suggest something called reactive arthritis, which is related to a sexually transmitted disease, typically chlamydia and not gonorrhea, but let's keep watching.
Rheumatoid.
That's typically small joints. This hit her knee.
Takayasu's arteritis.
When will these people start pronouncing things right? This is Takayasu's arteritis, which is a type of inflammatory disorder of the blood vessels.
Blood vessels.
Vasculitis with stomach pain, so Behçet's.
No, she'd have oral sores.
Or genital. Go find them.
Okay, I mean, Behçet's disease and Takayasu's arteritis, and they're definitely things that we study in medical school. All things considered, they're pretty uncommon and rare. So these are not the first things that we necessarily jump to when we are thinking about some of these symptoms. Now, joint pain and arthritis can be very common. Stomach pain, also very common. When we're thinking about some of these symptoms, we don't necessarily always try to lump them all together into one diagnosis. Obviously, it would be very convenient to, and we can try to unify everything, especially if the patient shows up with all of these symptoms sort of showing up at once. But usually we think about common things being common. We want to rule those out first before we jump into some of these more esoteric diagnoses.
Any pain? Is it bad? This will go a lot easier if you talk to me.
I'm sorry.
Wait, so what kind of doctor is Dr. Chase again? If I remember anything about House, it's the fact that everyone seems to know everything and can do everything across all specialties. Now, that's hardly the case in real life, so very unrealistic. But if he's doing a pelvic exam here, I can only imagine what he's going to be jumping into next.
Dr. Chase.
Hi. All right, let's take a look. That's what happened.
No appointment, no real examination.
Just gave you the test results.
So, lower standard of care, you really couldn't be expected to notice there was anything else wrong.
We didn't even go into an exam room.
Usually I like to see new patients in the clinic in a controlled environment where we can really review the existing medical records, we can talk about what sort of tests we're going to order, what the exact plan is going to be, rather than something like this that's sort of done in passing. And as a result, patients can fall through the cracks, things aren't followed up, so it's just best to really sit down and concentrate with the patient over a clinic visit rather than doing some of these things in passing over the phone and not actually thinking through things completely.
Person question only important when patient saves it for last, so you knew she was about to ask the most important question, and he left.
No, I didn't. I figured it out later.
What changed?
Nothing.
Bad answer.
I wasn't thinking clearly at first.
Worse answer. So what was her doorknob question?
I figured it might be blood in her stool, which could indicate a bleeding ulcer.
Uh-oh, red flag, blood in the stool. This is definitely something that I come across as a gastroenterologist. Sounds like things are about to get real.
Talk to me. 35-year-old female vomiting massive amounts of blood. LOC at work, BP 80/20, heart rate 140. Push flows, 3 liters in the field, and we're bolusing another one right now. It's gotta be a bleeding ulcer, doc. The coworker says she's been eating ibuprofens like candy.
Okay, so now she's vomiting up a bunch of blood right now. It seems like she's lost a lot of blood because they have to support her by giving her a lot of hydration through the IV. And he's saying that she's taking ibuprofen like candy. So ibuprofen falls into this class of medications called NSAIDs, or non-steroidal anti-inflammatory drugs. And medications that fall into this category include Advil, Aleve, Motrin, a lot of the common painkillers that you see over the counter. And these types of medications tend to be a gastroenterologist's worst nightmare because it affects the protective lining of the stomach and can erode away at that lining. And when that lining is no longer intact, it can lead to ulcers. Those ulcers can bleed. And that seems to be what they're referring to right now.
But you have Behçet's.
Like I said, Behçet's in the US tends to be pretty uncommon, and so common things being common, we want to think of other causes for her symptoms rather than something like Behçet's.
1, 2, 3.
Whoa, 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 whoa. Now they're pulling out this super slim scope, and this is starting to make me nervous. Let's just watch this whole scene first.
Nope. Nope. Nope.
Nothing in the scene makes sense.
So what they're trying to portray here, I think, is an endoscopy where they're going to actually go into the stomach and look for a source of bleeding. Something we definitely do. Now, first of all, the scope that they're using is not typically the scope that we use. And second of all, Dr. Chase here has somehow become a gastroenterologist after performing pelvic exams. Typically, gastroenterologists are the best trained doctors to be performing endoscopies. Sometimes surgeons do as well. But in any case, the other thing is that we usually place a plastic piece in the mouth to prevent the patient from biting down and damaging the scope, and also from the scope from damaging patient's teeth. So they definitely didn't use that. And then when they went down, there was a bunch of fluid floating around in the stomach. First of all, that fluid was clear. So when they say that it's bloody, it definitely didn't look bloody right away. And second of all, when you have a lot of fluid like that in the stomach, you try to suction it up right away because there's a chance that when the patient's asleep and unable to protect their airway and swallow properly, the patient were to vomit in their sleep, they wouldn't be able to protect their airway and they could potentially choke.
No. There. Bubbling. Just a bad ulcer. Cauterizing.
Can't see. Use some more saline.
Hold on. Okay.
First of all, bleeding can happen in a lot of ways. If bleeding is coming from an artery, it can often spurt. If bleeding is happening more slowly, like oozing out of a vein, it does tend to ooze out, but not like that. It doesn't tend to look like grape jelly. It tends to look more like, food coloring. And then he talks about cauterizing. First of all, that scope that he's using is too thin to fit in any sort of instrument to cauterize. And second of all, the type of cautery that they're suggesting here, where they're sort of like zapping from a distance, that is typically not the cautery that we use in this sort of situation. We have instruments that actually sort of push up against the ulcer so that the vessel underneath compresses and we can sort of burn and shut off that blood vessel. And we often use other ways like injecting medications to sort of cause the vessels to constrict. We also use clips to mechanically sort of close off blood vessels. But this, is just clearly dramatized.
Where's the ulcer?
It's brown. I cauterized it. It must be something else. There. Second ulcer.
Not anymore. It perforated. Get it to an OR!
So a perforation means he's created a hole in the stomach wall, and sometimes that can happen when you're burning too aggressively, although usually in the stomach lining is pretty thick, so it's hard to do that. But with an ulcer there, yeah, it could be easier to burn through there. Yes, traditionally the teaching was to take someone to surgery to have something like this repaired, but nowadays we have tools where we can clip, we can sew, we can use all sorts of devices to try to close off the hole that's been created, rather than rushing them off to surgery.
Due to the perforation. But the contents of the patient's, Kayla's stomach had spilled into her body. She got septic.
Then the infection lowers her blood pressure.
50 over palp at one point. It damaged her liver and kidneys. Listen, I know.
So what he means by that is that through the hole, some stomach contents probably flowed into part of the belly cavity. Usually outside of the gut, the belly cavity is sterile, but now you've introduced bacteria in there. Her body has now developed a severe infection, and her organs are being affected because when you have a severe infection, your blood vessels dilate, your blood pressure can drop, your organs aren't getting the type of blood flow that they typically need, and your liver can get damaged, your kidneys can get damaged. Now, that's all an oversimplification, but I can see what they're getting at. This isn't entirely inaccurate.
No, this looks bad. I obviously got the diagnosis. Listen, I know this looks bad. I obviously got the diagnosis.
Did everything by what book?
You're gonna hit Dr. House?
You haven't even seen my sister and you're being cute with me?
Sam, we're talking about it right now. A fever
Could
might...
be Hep B, Hep C, right? It's treatable. You give her interferon, she's okay, right?
You know a lot about hepatitis.
He just donated his liver.
You're flushed. You sick?
I'm tired.
You're hiding the fact that you're sick. Now, why would you do that?
Hey, what do you...
Either you specifically asked for a tattoo of a heart that's been left out in the sun too long, or that is a really bad home job. It's a very common way of getting Hep C, which you have. You've had it a long time.
Who's gonna keep me from giving my liver?
You paid off that lab tech to say you were clean?
It hasn't been active in years. She was gonna die if I didn't.
Oh my God.
It's totally unethical. Get an MRI for him and his sister right now.
She got Hep from me, didn't she?
No. No. God, no. I think she got cancer from you.
Well, first of all, you know that this is outdated because when he mentioned interferon as a treatment for hepatitis C, the treatment for hepatitis C has completely changed, and in most cases, cure can be achieved in over 95% of patients nowadays. So the first thing that's interesting is the talk about interferon. The second thing that's interesting is when he looked at his tattoo. And yes, going through medical training, we're often taught unsterile needles can potentially transmit hepatitis C from person to person. Now, the third thing that they're getting at is that potentially he donated part of his liver that had cancer in it. When we're talking about liver cancer and hepatitis, now traditionally we're taught that liver cancer can arise in patients with hepatitis B without the presence of scarring or cirrhosis of the liver. Now with hepatitis C, it's different. Typically these patients have cirrhosis before then developing liver cancer as a result of the chronic damage done to the liver. But it can often be confusing because nowadays with the amount of fatty liver that's in our population, fatty liver is also a risk factor for developing liver cancer. But in any case, in a normal transplant evaluation, all of these viral tests should have been done, but he clearly paid off the lab personnel to make up the test results, so that's out of the picture. But yes, normally these diseases are screened for before any sort of transplant is done. Now, even in donors that are positive for hepatitis B or C, that doesn't necessarily mean that they can't donate an organ. It just means that that organ should be going to someone else with hepatitis B or hepatitis C as well. But even if the brother paid off the lab, he should have undergone abdominal imaging where they would have picked up this tumor ahead of time. So yes, liver cancer in a donor would prevent them from being a donor. Liver cancer in a recipient doesn't necessarily mean that they can't get a donor organ, actually. Sometimes if recipients have cancer on top of whatever underlying liver disease they have, that might actually accelerate them to getting a liver transplant sooner.
The travel, the operation, even then, the cancer.
Kayla, we're going.
My dad died. Lung cancer. I saw him a couple of months before it happened. We never talked about it.
I'm sorry your father died, but it has nothing
He even
to do...
told me he was sick. I wish he had. You're gonna die. Alone. Thousands of miles from your children. You don't want to do that to them.
Kayla.
I'm sorry, Sam.
Kayla. You can't...
So it seems like her brother was on his way to fly her down to Mexico to get another organ off the black market, potentially subject her to a risky situation. And what Dr. Chase is getting at is that, you know, we need to weigh the risks and benefits of doing all of this. And if we're pretty sure that things aren't going to turn out so great, then we might as well focus on some of the positives and making sure that you spend enough time with your family and are comfortable. So him redirecting that conversation, I think, is sometimes the appropriate thing to do. Anyway, that's enough for this episode. My mind is blown by how confusing and sometimes hilarious this show is. All in all, I mean, obviously there's great drama, it's great entertainment, so I'm not gonna knock them for that. But let me know in the comment section below if you know of any specific episodes that you'd like me to react to, and I'll be sure to check them out. Alright guys, thank you so much for watching today's video. I truly enjoyed reacting to House MD. Hopefully you found this educational and helpful, and until the next video, I hope you guys stay healthy, and I'll see you in my next video. Bye guys!